The key goal of AHEC is to recruit and retain a diverse workforce when it comes to medicine and healthcare.
Training health profession students to really go back and practice to the areas that need them the most. We have 9 total regional centers that serve both underserved urban communities and underserved rural communities.
Getting out within those communities and finding out what the needs are and how we can assist them is a part of what we do as an AHEC center.
The Illinois AHEC Network has developed a number of programs to increase the awareness and interest and excitement around students pursuing a career in the health professions. It's incredibly important to get students interested in health careers as early as possible.
Being a part of Ahex Scholars definitely opens the doors to various possibilities in healthcare.
Ahex Scholarship is a really innovative program. It's really aimed to increase awareness and understanding of different issues that impact health status and health outcomes for underserved rural and underserved urban populations.
You get to network with industry professionals. If you want to become a medical doctor, chances are you have access to them when you are an Ahex Scholar.
We also have a program called the Rural Health Experience, which is a 3 to 5 day program aimed at getting students into communities and really understanding those unique needs. They get to talk to hospital CEOs in these areas. They get to talk to local health department administrators and other practicing health professionals to really understand the challenges and successes that they can experience in that profession one day. Our 6-week summer interprofessional preceptorship program. It has a lot of really innovative components where students can actually work in a community setting, develop a community service learning project with students who are outside of their own discipline.
The preceptorship was really rewarding because I was able to work with other healthcare professionals. I was able to really interact with just about everybody in the healthcare team.
These AHEC experiences set them apart from other students because it gives them a well-rounded education.
I was able to use the skills that I learned through my preceptorship right away here at RMed. Getting to see all this public health data beforehand through my preceptorship really did set me apart from my peers.
Students are able to see hands-on, in-depth, and have experiential opportunities beyond just the classroom. They get to get a sense of the culture and the needs of the community, and they form that relationship with those employers early on so that once they're ready to graduate and ready to pursue a position somewhere, they already have a network built.
Really meeting people where they're at is so critical, especially in our rural and underserved areas.
It's all about student mentorship and developing those relationships early on with students so that they know that there's support throughout their educational pathway.
For practicing professionals, we partner throughout the region to provide different training opportunities that would help them clinically within the region.
This interaction of all of the healthcare team that I was able to see during my rural health experience, it has reaffirmed for me that I want to practice in a rural setting, specifically a rural hospital. I knew that I wanted to be a part of that in the future.
Healthcare professionals are natural leaders in their community, so we want them to be able to step into that role when they finish their education.
You don't have to necessarily start out with all the resources in front of you. You can build networks and you can build connections and really find your path and make a difference in the long term.
You may find a new passion.